What's up, friends? Rob Sevilla with Agape Insurance and Financial Group here in Tupelo, Mississippi. And today I'm going to be answering the question, how can I get affordable health insurance if my current job doesn't offer it to me? Well, that's a great question that we get asked all the time. And I'm going to give you what I believe is one of the best answers or best solutions to that problem. And that is through the Affordable Care Act, formerly known as Obamacare. Now, I want to just squash one myth right out of the gate, because so many people think that Obamacare or the Affordable Care Act is only for poor people or really low income people. And that is not the case. Here at Agape, we got doctors, single moms, real estate agents, contractors, college students, all different income ranges and household sizes on the Affordable Care Act. And it's working really, really well for both these families and these individuals. So why is the Affordable Care Act a great solution? Well, here's one main reason. All pre-existing conditions are accepted. So we see this all the time where someone is needing quality, affordable health insurance, but because they're a diabetic with insulin, or maybe they have AFib, or maybe they've been diagnosed with something else that's a red flag, they're not able to get underwritten anywhere unless it's through an open enrollment period or it's offered through their job during this open enrollment period. Okay, so what we see with the Affordable Care Act is they're going to take you as you are. Doesn't matter your height and weight. It doesn't matter your medical history. It doesn't even matter how many medications that you are currently on. So all pre-existing conditions make it a great solution if your job doesn't offer it. Number two is low monthly premiums. So the premiums are based off of your household size and your income. So this is a perfect plan for like single moms or parents who are only a one income household and they are needing quality health insurance for themselves and possibly even for their kids if they can't get Medicaid for whatever reason. And I want to show you an example here of how we put together a quote for people that we work with, because we do this all the time and have hundreds of clients in multiple states. And so this is a platform that we use called Health Sherpa. By the way, if you're a person that likes to do this all yourself and you don't want to have to deal with anybody, there's a link in the video description where you can start this process yourself, and then we can come alongside you and help you if you're more of a hands-on type of person. Or if you just say, hey, I need your help, you can simply call us at the number in the video description, our office number, and one of our health advisors would be more than happy to help you. But in where I live in North Mississippi, Tupelo specifically, you can see here that I put one of our zip codes here. Let's just say we have a household family of four, household income. We're just a one income house, or even if you're a dual income, just the household income is $65,000. Let's say that the husband is 40 years old, the wife is 38 years old, and they're non-tobacco users. And then they have a 10-year-old female, and then they have a 10-year-old son. Okay, so this is a family of four that's making $65,000 a year. I'll up the income here in just a second, but we'll just go with this example. It tells me over here that their eligibility is they're eligible for a $1,185 subsidy, and we're going to take a look at that real quickly. So in our area, there's really about four main companies that are available here in our state that work well. But more specifically in our area, we see the best results with two companies, Ambetter or Magnolia Health and Cigna. So I'm just going to filter the other ones out for now. And as we go through here, you can see it starts with really high deductible plans. Okay. And by the way, these rates are for the whole family, not just for the husband and the wife or just one of them individually. And you can see the subsidy there. These plans for the whole family are supposed to run $1,329.57 per month. But as you see, as the deductible is going down, the premium goes up. And so even a lot of times your work insurance is going to have some high deductibles, some high max out of pockets, some co-pays if you go see the doctor. But I'm going to go through here because generally most people are going to land around between about a $3,000 to $6,000 deductible, just to keep the premium affordable. But the good news is even though, like on this particular plan, it's $250.69 per month, right? It's supposed to run almost $1,400 or over $1,400. It has a $5,700 deductible. The good news is when I go see the doctor, all I'm going to have to pay is a $30 copay. If I go see a specialist, it's a $60 copay. And then I have a max copay with my generic drugs of $20. So the good news is I do not have to meet my deductible just to go see my doctor. I see a lot of people get put on these bad plans where they have high deductibles with no copays, and they have to meet that deductible first before they're able to go to the doctor and pay anything. In this particular case, it's not so. So we never, here at Agape, we never want to put you on something that has a high deductible with no copays built into it, because then once again, it feels like you're paying the whole thing, which you are up until you meet this particular plan. But we'll just keep going here. You see a $4,100 deductible. It's $271. All right, I'm going to go to the next page here. And we see a low deductible with Cigna here of $3,250 shows $283.50. It's got copays built into it. So as you can see, the lower deductibles are going, right, the higher the premium. Here's one for zero deductible for $329.51. This is for a whole family, not just for one person. This is for this whole family of four. And once again, if I go up here and let's just say I put 85,000 into the income, you're going to see the prices. We have no control over the algorithm. They have this all figured out. We just simply plug in the criteria and it spits out the deductibles and the premiums for us. And so I'm going to go try to find a low deductible program here. 1 second. All right, let's find. Okay, here's that same Cigna zero deductible for about $200 more per month. So once again, this is for a family of four. And even with the higher income amounts, what we are finding is that it's still more affordable for a family to go this route where they barely can afford, if they can afford at all, the group insurance that was offered to them. And then even a lot of times, even if your job doesn't offer health insurance or group benefits, a lot of times going through the Affordable Care Act is still the most affordable solution. And a lot of times it's beating those group rates by 30 to as much as 50%. So not only does it take pre-existing conditions, not only does it have low premiums, low copays, and the opportunity for you to get low deductibles depending on what your budget is, but also it has a strong network in most places that we work in. So they have pretty robust, pretty comprehensive networks when it comes to the doctors, the specialists, and the hospitals. However, this is an important note here. You always want to make sure that you're dealing with someone who's checking all of your doctors, who's checking all of your medications, who's checking all of the hospitals that you would go to if, God forbid, something happened, to make sure that they are in the network. Okay, so most of the time, what you're seeing here is very strong networks, pretty comprehensive networks in most of the areas that we have seen and that we work with. So real quickly, let me just do a quick timeout and just tell you this. If you're getting value out of this particular video, please like, comment, subscribe below, turn on the notifications, because we're always dropping fresh content like this, because our goal is to help all of you make sure that you're getting the most quality and affordable health insurance there is available to you at the lowest premium possible. If I could put it this way, we want you to get the most bang for your buck. So let me quickly recap. Number one, they take all your medical conditions, no matter what your past is. Number two, low copays, low premiums, low deductibles. You can have an access to that. You can have access to that. And then number three is, in most cases that we have personally seen in the states that we work in, we have seen pretty strong networks, and most providers in most areas are in the network. So what do you do if your company does not offer group insurance? This, in our opinion, is one of the best routes to take. And once again, you want to do it yourself, the link is below in the video description, or you can simply call us at the number below at our Tupelo office. Real quickly, whether you're a contractor or a subcontractor or a 1099 or some type of small business owner or entrepreneur, these plans can work good for you as well. Or if you're a single parent and you're needing quality insurance because you can't get Medicaid, but your kids can, this is a great option for you as well. Or maybe you're a college student who doesn't have access to their parents' insurance, or your parents can't afford for you to be on their group insurance. This is a great option. Or even if you're turning 26 and you're being forced off of your family's group plan, this is also a great option for you as well. So once again, thanks for watching, and we'll see you on the next video.